Lennox here, and today we will be demoing this inversion board. And this inversion board is used to help people who have spinal problems. It can stretch out your spine, and it can help with a lot of pain. I have a arthritic disc in my neck. I've been doing this for, I don't know, a couple months, and I do notice that it has helped a lot. I won't say it's cured it, but it has made it a lot more bearable, and I don't feel as much pain as I did before I started doing this. So I'm going to show you how to do this, and if you'll notice down here, you probably can't see this, but you can adjust this for your legs, and you adjust it by your height. So it has many adjustments. You pull this out, you go down to over 6 feet. I'm going around 5'9" right here, and also has a lumbar support which you can use or take off. I'm going to leave it on. It seems to help stretch my spine a little bit better. And so first, you get in it like this. You should wear shoes and socks for this. It can be a little painful on your feet when you're hanging upside down. So it's probably better with the shoes and socks, a lot better. Also, less likely to slip out of it when you're upside down, and you don't want to slip out of it for sure. So you got a little lever here, you pull up and just adjust this, push it down so it snaps in, make it kind of firm, and a little too firm. And I think that'll work. So now, in order to tip over, you can start leaning back, raise one arm, and you'll start tipping. You should probably do this kind of slow at first to get used to it, and I wouldn't be doing it for a very long amount of time. Once I get tipped here, alright, so now, although I'm not completely hanging upside down, I'm very inverted. I do have a little bit of support from the backrest here. But yeah, I'm pretty much hanging upside down. What I'm going to do is take a few deep breaths and try to relax into this position. I can feel my spine, the lower spine, and my neck starting to stretch out here. I would say that anyone who has eye problems, such as glaucoma, anything like that, probably should not do this exercise, because you do feel a pressure in your head and eyes from being upside down. Although once you get used to it, it's probably good for you, I think. So you can do this. I try to do it normally for about 5 minutes. You can start with a couple minutes or 1 minute, and then work up to 5 or 10 minutes, and that's probably will be fine. That's all you need to do, and you don't even need to do it every day. So when you want to come back up, you can reach up and just pull yourself up with these handles, and you can lean forward to get yourself over there. So you should sit here for a minute, make sure you're not too dizzy from being upside down. once you're good, and just pull this up and step back. And there you go. This is my demo. This is just for the inversion part of it. There's also exercises you can do, which we may do some later. But that's showing you how to invert. Thanks for watching. Go ahead and subscribe if you liked it, and hit the like button. Thanks a lot.